Welcome to my channel Wellness Wisdom. In this video, I'm going to talk about diabetes. You may have heard a lot about diabetes. Almost 14% of world's population, more than 100 million people, are suffering from diabetes right now. By definition, diabetes is a group of metabolic disorders characterized by high blood sugar levels. Or simply we can say diabetes is a disease that occurs when our blood glucose, also called blood sugar, is too high. Food we eat or drink, most of it is converted into glucose. This glucose then enters our bloodstream. When glucose level goes up, it is sensed by pancreas. Pancreas is an organ of digestive system and endocrine system. It secretes a very important hormone called insulin. Now, how does insulin work? Insulin helps glucose that is present in our bloodstream to enter the cells of our body. When this glucose enters the cells of our body, cells utilize this glucose for different metabolic functions and activities. In this way, blood levels of glucose do not increase. This is the normal process taking place in our bodies. What happens in diabetes? Either your body can't make insulin at all, or the insulin your body makes can't work effectively, or body can't produce enough of it. Both of these conditions lead to increase in the blood glucose levels, resulting in a condition called hyperglycemia. It is very important to know about different types of diabetes. There are two major types of diabetes, type 1 diabetes and type 2 diabetes. Other rarer types of diabetes are including gestational diabetes, neonatal diabetes, maturity onset diabetes of the young, secondary diabetes, etc. Gestational diabetes develops during pregnancy, usually second or third trimester. Neonatal diabetes develops during the first 6 months of life and it's a rare form of disease. Maturity onset diabetes of young is caused by genetic mutations. Secondary diabetes is due to another medical condition or treatment. Let's see what happens in type 1 diabetes. As we have already talked that pancreas produces insulin. There are beta cells in the pancreas who are responsible for insulin production. Insulin then helps glucose to move inside the cells. Type 1 diabetes is an autoimmune disease in which immune cells of immune system destroy beta cells in the pancreas. When beta cells in the pancreas are destroyed, pancreas cannot produce insulin. As a result, glucose levels in blood increase. What is type 2 diabetes? It is a metabolic disorder in which there is an insulin resistance and impaired insulin secretion. Both of these will lead to increased blood glucose levels. People who are having increased risk of developing diabetes are those with positive family history and genetic predisposition, obese people, people who are physically inactive with sedentary lifestyle. Risk factor also increases with age, especially after 45. Certain ethnic groups like African Americans, American Indians, Hispanics, and Latinos, they have more chances to develop the disease. Women who have had history of gestational diabetes and polycystic ovary syndrome are at increased risk to develop diabetes. Untreated sleep apneas and use of certain medications like steroids and psychiatric drugs, etc., they can also increase the risk of developing diabetes. When blood glucose levels increase, symptoms of diabetes start to appear. Urinary frequency increases, patient is always hungry, complaining of extreme fatigue, blurred vision, tingling, weight loss, increased thirst, and slow healing of wounds are the most common symptoms of diabetes. If treatment is not started at right time, increased blood glucose levels may damage nerves and blood vessels. As a result, complications of diabetes may develop. One of the major complications are cerebrovascular disease. It is a group of conditions in which normal blood flow to the brain is affected. As a result, stroke may occur. Diabetic retinopathy, in which there is an abnormal growth of blood vessels in the retina, leading to vision problems and blindness. Other complications are permanent kidney damage and heart attack. Diabetic foot is one of the most common complications. Here we should understand something about diabetic foot. Due to increased blood glucose levels, there is nerve damage and poor blood flow, resulting in foot ulcers and foot infections. So, diabetic foot is a term used for any foot condition that develops due to diabetes. Peripheral neuropathies are due to nerve damage, in which patient complains of pain, weakness, and numbness in the area, especially hands and feet. There are different tests to diagnose diabetes. A very basic test is fasting plasma glucose test. In this test, blood glucose levels are measured after an overnight fasting. Another test is oral glucose tolerance test. In this test, blood sugar levels are measured after taking a sugary drink. Another important test is hemoglobin A1C test, also known as HbA1c test. It is a very important monitoring test for diabetic patients. In this test, average blood sugar levels are measured over the past 2 to 3 months. Another test is random plasma glucose test. In this test, blood sugar levels are measured at any time. A big challenge is how to manage diabetes. Lifestyle modification comes to play a big role, and its key component is eating healthy and balanced diet with less fats and less sugar. Other important things to do to change and improve your lifestyle are including regular exercise, weight management, reducing stress in your daily life, and most important, monitoring blood sugar levels on daily basis. Treatment of diabetes includes oral medication and insulin therapy. Most commonly given oral drugs are metformin, sulfonylureas, and DPP-4 inhibitors. Insulin therapy includes injectable insulin such as basal insulin, bolus insulin, or premixed insulin.